Nursing Diagnosis Part 4. Disease conditions are 1. Diverticular disease. 2. Epilepsy. 3. GB syndrome. 4. Head injury. 5. Heart failure Cor Pulmonale. 6. Hiatal hernia. 7. Hypertension. 8. Hyperthyroidism Graves disease. 9. Increased intracranial pressure. Diverticular disease. A condition in which small, bulging pouches develop in the digestive tract. It's common in people over the age of 40. Nursing diagnosis are constipation related to narrowing of the colon secondary to thickened muscular segments and strictures. Acute pain related to inflammation and infection. Epilepsy. A disorder in which nerve cell activity in the brain is disturbed, causing seizures. Epilepsy may occur as a result of a genetic disorder or an acquired brain injury, such as a trauma or stroke. Nursing diagnosis are risk for injury related to seizure activity, fear related to possibility of having seizures, GB syndrome, a condition in which the immune system attacks the nerves. The condition may be triggered by an acute bacterial or viral infection. Nursing diagnosis are ineffective breathing pattern and impaired gas exchange related to rapidly progressive weakness and impending respiratory failure. Impaired bed and physical mobility related to paralysis. Imbalanced nutrition, less than body requirements, related to inability to swallow. Impaired verbal communication related to cranial nerve dysfunction. Fear and anxiety related to loss of control and paralysis. Head injury. A head injury is any trauma to the scalp, skull, or brain. The injury may be only a minor bump on the skull or a serious brain injury. Head injury can be either closed or open penetrating. A closed head injury means you received a hard blow to the head from striking an object, but the object did not break the skull. Nursing diagnosis are ineffective airway clearance and impaired gas exchange related to brain injury. Ineffective cerebral tissue perfusion related to increased ICP, decreased cerebral perfusion pressure CPP, and POS-Sibyl seizures. Deficient fluid volume related to decreased LOC and hormonal dysfunction. Imbalanced nutrition, less than body requirements, related to increased metabolic demands, fluid restriction, and inadequate intake. Risk for injury, self-directed and directed at others related to seizures, disorientation, restlessness, or brain damage. Risk for imbalanced body temperature related to damaged temperature regulating mechanisms in the brain. Risk for impaired skin integrity related to bed rest, hemiparesis, hemiplegia, immobility, or restlessness. Disturbed thought processes deficits in intellectual function, communication, memory, information processing related to brain injury. Disturbed sleep pattern related to brain injury and frequent neurologic check. Interrupted family processes related to unresponsiveness of patient, unpredictability of outcome, prolonged recovery period, and the patient's residual physical disability and emotional deficit. Deficient knowledge about brain injury, recovery, and the rehabilitation process. Heart failure. A chronic condition in which the heart doesn't pump blood as well as it should. Heart failure can occur if the heart cannot pump systolic or fill diastolic adequately. Nursing diagnosis are activity intolerance and fatigue related to decreased CO, excess fluid volume related to the HF syndrome. Anxiety related to breathlessness from inadequate oxygenation. Powerlessness related to chronic illness and hospitalizations. Ineffective therapeutic regimen management related to lack of knowledge. Hiatal hernia. A condition in which part of the stomach pushes up through the diaphragm muscle. In hiatus hernia, part of the stomach pushes into the chest cavity. It enters via an opening where the food tube esophagus passes on its way to the stomach. Nursing diagnosis are imbalanced nutrition, less than body requirements related to difficulty swallowing, risk for aspiration related to difficulty swallowing or tube feeding, acute pain related to difficulty swallowing, ingestion of abrasive agent, a tumor, or reflux. Deficient knowledge about the esophageal disorder, diagnostic studies, treatments, and rehabilitation. Hypertension. A condition in which the force of the blood against the artery walls is too high. Usually hypertension is defined as blood pressure above 140/90ths and is considered severe if the pressure is above 180/120ths. Nursing diagnosis are deficient knowledge related to the relationship between the treatment regimen and control of the disease process. Noncompliance with therapeutic regimen related to side effects of prescribed therapy. Hyperthyroidism. The overproduction of a hormone by the butterfly-shaped gland in the neck thyroid. Hyperthyroidism is the production of too much thyroxine hormone. It can increase metabolism. Nursing diagnosis are imbalanced nutrition, less than body requirements related to exaggerated metabolic rate, excessive appetite, and increased gastrointestinal activity. Ineffective coping related to irritability, hyperexcitability, apprehension, and emotional instability. Low self-esteem related to changes in appearance, excessive appetite, and weight loss, altered body temperature. Increased intracranial pressure. Increased ICP is when the pressure inside a person's skull increases. When this happens suddenly, it is a medical emergency. The most common cause of high ICP is a blow to the head. The main symptoms are headache, confusion, decreased alertness, and nausea. Nursing diagnosis are ineffective airway clearance related to diminished protective reflexes, cough, gag. Ineffective breathing patterns related to neurologic dysfunction, brain stem compression, structural displacement. Ineffective cerebral tissue perfusion related to the effects of increased ICP. Deficient fluid volume related to fluid restriction. Risk for infection related to ICP monitoring system, fiber optic or intraventricular catheter. Thank you for watching. Like, share, and subscribe.